All right, welcome everybody. We will get started with our coronavirus update for Colorado. We're here with two guests to talk about their experiences with the virus, Dr. Alan Michael Vargas and Marissa Duran. They both work at Grand River Health Clinic in Parachute. As we know, this current outbreak is affecting our entire state, but for many in Western Colorado, it's their first major experience with the virus. They didn't have that same March, April experience with the virus, fortunately, and the summer peak that other areas expected. Across the state, this is the worst it has ever been, but it is the first time that they've really gotten to see the virus in Western Colorado. They're going to share their experience as healthcare workers, and Marissa as a survivor. Dr. Vargas is somebody who will update us on what he's currently seeing in Western Colorado. An update on the numbers today. Another really unfortunately big day. 5,765 new cases. We currently have 1,564 Coloradans that are hospitalized with COVID-19 in Colorado, and we know that many will make it out and some won't. And we have lost 2,355 Coloradans to COVID, and our heart goes out to the survivors, the family members of those who were lost. Colorado, sadly, along with the rest of the nation, continues on its upward trend. We're hopeful that the new changes that are being made around indoor dining in most places and capacity in gyms and just making sure that people don't socialize with people outside their household, and that's the most important message. We hope that this changes the trajectory, but it's also important that Coloradans are realistic. It takes 2 weeks for that to change the trajectory, a week or two before really that starts showing up. So we're in for some tough days ahead. I'm really hopeful that given the heightened level of danger and the fact that at this point, Colorado, you probably know somebody, and you might be hoping now that they recover who has COVID, or it's in your community. It's in all of our communities. Nationally, we reached a very grim milestone: 250,000 Americans who we've lost to COVID-19 during the pandemic. To put that in perspective, that's more than twice the number of Americans lost in World War I. Now is the time to be extra cautious. You know what you need to do. We simply need to do it better. Um, not just avoiding contact with those outside your household and not just wearing a mask in public, but try to cut down on other stuff too, right? Instead of going to the grocery store twice a week, go once a week and pick up more. Consider ordering for delivery. You can take delivery from your favorite restaurant instead of going out to their patio. The most important thing is avoid social gatherings. That means connecting with friends or family. Do it virtually instead of in person these next few weeks. We'll all be able to gather together fully, safely, and normally to get the vaccine. There's light at the end of the tunnel. It's so soon. That's why this setback is really so frustrating. It's not interminable. It's not going to go on forever. In March and April, we didn't know how long it would go on. This is very close, folks. The first Coloradans are going to get the vaccine in December. Now, that's mostly frontline workers and nurses and others, but it will be increasingly available early next year for many more Coloradans, beginning with those who are 65 and older. So the end is in sight, but it's still a long time from now till then. And it could make the difference of thousands of lives, maybe even your own, if you do the right thing and simply avoid socializing with others, cut back, do what you need to do, right? You go to work, you're as safe as you can at work, wear a mask if it's indoors, come home. If your kid's in school, they go to school, they come back, but avoid all that other stuff, which I get it. It makes life worth living. We all want to have it, but we all just need to be patient and wait until we can enjoy those things again without threatening the loss of life of our loved ones. We earlier this week announced many of the measures taking effect in a number of counties. I'm hopeful that this will help turn the corner for those counties. We look forward to a strong collaboration with every county, and many counties and even municipalities have mitigation plans. Many of them have been vetted through CDPHE. They go above and beyond, what the state is doing. they're thoughtful, they're locally tailored. We encourage that. We want every community, and we trust every community to really be the very best communicator about how to really make sure that they can get through it and improve safety. I want to make sure that everyone knows that we should avoid personal gatherings. You've heard me mention that a number of other times. That means, don't drop by your neighbor's house for a drink after work, no dinner parties. It just that is one of the venues that this spreads, right? And there's, we oversee what we oversee with the policy levers, and obviously, restaurants and bars have licenses from the state, and they need to be healthy and good times, right? Even when there's no pandemic, we make sure they don't have, salmonella outbreaks or hepatitis outbreaks, and that's because you have a reasonable expectation that when you go out, it'll be reasonably safe. Now is the time when what was always reasonably safe is no longer reasonably safe. And we are losing Coloradans every day to this horrible virus. And it is in our power. It is in our power to stop that. And I know that together we will. All these decisions, when you're making them on that ground scale, they might not seem like big decisions. Should I have a couple friends over for drinks? Should I, they don't feel sick, I'm not sick. But remember, you're interacting with their bubble and their bubble. So, right now, and it's rather shocking, but about 1 in every 49 Coloradans are contagious with this. And so if you have 3 or 4 friends over for drinks or dinner, there's a very high likelihood, if you have 5 people over, you got a 1 in 10 chance of being exposed to the virus right there in the ideal environment where you will likely get it, which is indoors without a mask. And that's, it's scary. I was shocked too when they said 1 in 49, and it's close to that. It's close to 1 in 50, 1 in 60, just to kind of back of the envelope here. So we identify about 5,000 cases a day, right? We know we're only getting about half of them. There's probably 10, 11, 12,000 a day, about half of them ID'd, half of them not. Each case infectious for about nine days on average. So that gives you somewhere around 100,000 or so Coloradans that are currently contagious. It's 1.6, 1.7% of our population. So you get to that 1 in 60, 1 in 70 number. And then the modelers say it's 1 in 49, but it's somewhere in that range. It's extremely prevalent. It is in our communities. Like literally everybody that you encounter, could be contagious at this time when you're talking 1 in 50, 1 in 60, 1 in 70, depending on where you are in the state. And remember that especially 20-somethings, 30-somethings, you'll get about probably, I think the latest science shows probably over 50% asymptomatic. Now, folks 40s, 50s, 60s is probably more like 40% asymptomatic, still very high. So, not knowingly giving it to people. And then, of course, I don't know why I need to keep saying it, but of course, if you have symptoms, right? If you have a cold, flu-like symptoms, even minor, loss of sense of smell, fever, cough, any of those, isolate and quarantine yourself. Yes, of course, go out and get tested by all means, but don't have somebody drive you to get tested, right? It's a good chance you have the virus. Don't expose somebody in the confines of a car. Take yourself. If you have no one to drive you, you can't get out without exposing somebody, then simply try to get better in your home, and if you experience more severe symptoms, get medical help. But for the mild to moderate cases, it's bed rest. You need it home. Now, if any difficulty experiencing breathing, lack of oxygen, passing out, immediately go to the hospital. You probably need oxygen, and many of the people who receive oxygen will get through it. And then, of course, some don't and take a turn for the worse, require intubation. And at that point, your odds are more like 50-50. I know this is tough. There's a lot of people in our lives that we love. We trust them dearly. It's not a matter of trust. It's a matter of being smart. The fact of the matter is, if you don't live under the same roof, and it's a given that if you live under the same roof, you're going to be sharing germs. Obviously, if somebody's in quarantine, maybe depending on your house, they can lock down in a different part of your house. But for most of us and families, you're sharing the same germs. So if you don't live under a single roof, the safest thing to do is simply avoiding seeing people other than absolutely necessary over the next few weeks. And I know a lot of Coloradans have to go into work for every day. You had to go into work in March and April. At that point, it was called essential work. Everybody's work is essential. Now it's a broader group. Everybody, a lot of folks have to go into work. Just take those common sense workplace precautions as well. Wear a mask, physically distance. It should be it's responsibility of your employer to accommodate that. It's also the responsibility of your employer to empower telecommuting, if at all possible, for your job. And I get that it's not possible for every job, and to those men and women who can't telecommute, who have to work, I want to thank you. We as a state know that we can't function without you putting yourself at that extra degree of risk every day, and we owe you a debt of gratitude. State of Colorado, over 31,000 workers. We have most of our folks telecommuting, 65, 70%. But you know what? The CDOT worker who clears the snow can't telecommute. The state trooper can't telecommute. The folks guarding our prisons can't telecommute. And we appreciate them, and we appreciate you. These are also very challenging times for Colorado small businesses. It's unfair that our small businesses are paying the price for fundamentally a lack of personal responsibility and us each taking charge of preventing the spread of the virus in our own lives, which is well within our power. There's more that we can do to step up for our small businesses. And that's why on Tuesday, in partnership with legislative leaders, I announced that we're convening a special session of the legislature to address the urgent economic issues around the pandemic. They will be coming back in 10 days, November 30th. Yes, at some risk to themselves. In fact, they're going to, of course, have protocols in place for members of the legislature who are quarantined or ill themselves to telecommute. We wish Representative Meg Frulich a speedy recovery. She has coronavirus currently. And I want to thank the legislators for being willing to come in to do the necessary people's work to help meet the need for rental relief, for help for restaurants and bars, for help to make sure that childcare can continue to go on in our state, for food pantries, for Wi-Fi and broadband for kids. So thank you. Thanks for being willing to come in. As a state, we're going to do everything we can. We're going to sweep under every rug. We're going to find every dollar we can to help those in need, our small businesses, people whose employment have been hit. But you know what? There's nothing Colorado can do at the size that our nation can do. United States of America, the wealthiest nation in the world, needs to step up. I continue to echo my call on Congress, Democrats, Republicans, to get together and do what they need to do. Find those areas of agreement. I know you can't agree on everything, but they agreed on a lot in the CARES Act. I know there's a lot of overlap on the next bill. And I've talked to Speaker Pelosi, I've talked to members of our federal delegation, I talked to President-elect Biden, really to stress the importance of federal action to make sure that America can get through this. When you look at the nations that have more successful than us, less loss of lives per capita, less infection per capita, it's because they have a strong national strategy. And we will continue to be a constructive partner with the federal government and with our neighboring states. And I was on the line with several governors of neighboring states earlier today as well, to forge ahead a strategy that works better. Now, this is a very concerning trajectory in our state, whether it's 1 in 49 or 1 in 64 or 1 in 70, depending on where you live. That's a lot of contagious people. Here's the best advice I can give you. Avoid interactions to the extent you can with others, especially indoors and especially without masks. Limit those interactions, but treat every interaction like that person that you're talking to could be a trusted friend or neighbor, could be a complete stranger, but treat every interaction like that person is contagious with coronavirus. Because guess what? So many of us are. 1 in 50, 1 in 60. You interact with 5 people a day, you've probably interacted with somebody who's contagious with coronavirus. Doesn't mean you'll get it. Take the precautions. That's why masks are important. By the way, masks, the data shows, yes, of course, to prevent you from spreading it, but also effective at protecting yourself by 50 to 75%. That's sizable. We all hail a vaccine that's 90, 94% effective. You know what? We have one today that's 50 to 75% effective. It's called wearing a mask. And it's called wearing a mask properly. It's called wearing a mask over your nose and mouth. 50 to 75% effective. at preventing yourself from catching the virus, even better than some of the earlier studies showed. Yesterday, we had over 6,000 cases. The trend continues today. Our positivity rate is around 12%. Not as bad as some of the ground zero states to our north, but worse than anything that America or Colorado has seen before. We are also getting more and more worried about capacity at our hospitals, which brings me to the two guests we have today. In many red level counties in our state, ICU capacity is close to 90%. It is more dangerous than it's ever been before. It's really time to buckle down. This map shows you a time lapse of where we were in October, where we are now. I just want you to see how rapidly this virus, when you give it that vector, when you give it that way of life that allows it to exponentially grow, it does it. It grows. We are now at full hospital capacity in Mesa County. We have 3 ICU beds and no non-ICU beds in Weld County. This is not yet at no availability statewide or the Denver metro area, but what is happening in Mesa and Weld absolutely can happen elsewhere, and we're seeing that increase in the metropolitan area as well. Our guests today are joining us from Garfield County, which is seeing a skyrocketing increase in cases. Dr. Alan Michael Vargas is the chair of the Colorado Rural Health Clinic. He's a physician at Grand River Health Clinic who he'll give his own experience just in the last few weeks, what he's seen, right? Saw, of course, a little bit over the last 9 months, but just the last few weeks. So Dr. Vargas, thank you for joining us today from Garfield County. I want to hear about your experience as a healthcare worker on the front lines of the virus. I think we'll all benefit from learning about what you're seeing right now in Western Colorado.
Well, thank you for introducing me. It's a pleasure to be here today. I was thinking about how to address the state at this point in time, and I think just being very genuine and candid would be the best way to do it. Living and practicing medicine in rural Colorado on the western slope, it's been easy to daydream about COVID being something that's plaguing these urban cultural centers or overcrowded areas. But let me tell you something. Each day while I'm preparing for work, I'm shedding my tie, even though I'm wearing one today, and my shirt for some beat up canary blue scrubs. And I do that on a daily basis. And quickly in that morning, I'm reminded about the pandemic plaguing our country. And although in our part of the state, our neighbors can be even separated by acres of land, we're still seeing COVID-19 spread through our communities, just as we just went through at this point in time, watching that time-lapse slide. Over the past few weeks, I spent hours gowned in plastic in our respiratory clinics as caring for our patients in our communities, watching the number of COVID-19 cases increase, pretty much driven by my oath of medicine, but also my oath to my neighbors, to my community, to helping reduce the spread and the burden as the virus moves through our town, communities, and families now. I see my neighbors, my coworkers, and my families as I navigate through a barrage of emotions in this clinic, stemming from a new stuffy nose, body aches, or a simple cough. This is what we're seeing, and everyone is worried at that point in time. Do I have this virus? Questioning if they have contracted the virus, how would it affect me? That's a very difficult question. The majority of individuals with COVID-19 are receiving testing and care outside of the hospitals. And a wealth of frontline experience is being developed by primary care physicians across our country. Over and over again, the few things that we are seeing working well, and Governor Polis went ahead and said it, is minimizing our individual risk and our community risk with wearing a mask, socially distancing, and minimizing those unneeded exposures. Masks alone reduce our risk, but unfortunately do not reduce it to zero. We got some beautiful numbers today about percentages, but it's not zero. Distancing matters. Usually at the end of my day while I'm removing my plastic gown, I think about, the earlier nights that we're hitting going into the winter, my cold walk around the snow in my home, because I have to go into the back to shower before seeing any of my family. But mainly I also think about the people I've seen that day and how best I can treat them to minimize the harm and the spread to others in their family or in their communities. The holidays have arrived, and usually with that comes large family gatherings. But the best thing we can do for our families at this time is to minimize our risk and stop the spread within our families, our communities, and our homes. Love you from a distance. This season will matter.
Thank you, Dr. Vargas. Now, Marissa Duran is a survivor who was likely exposed because of her work in health. She works at Grand River Health Clinic. She has thankfully recovered, but she'll share some of her own experiences with the virus. Marissa Duran, thank you so much for joining us.
Thank you for having me. It's a pleasure to be here today and share my experience. It's really hard to say where I did get COVID. It's hard. You know, we don't really know what we're walking into in the grocery stores, at work, or whatnot. So it's really difficult to say where you're getting this virus from or from who you're getting it from. It was a little bit of a difficult experience for me. Being home was very tough. I'm not a homebody at all. So mentally, that was very, very difficult. My symptoms developed on October 27th. They really just hit me really, really quick without really any warning. All I mainly had was a lot of body pain. It wasn't really much aches, but it was body pain, more in the back area. Never thought that I had COVID or that my test results would come back positive. I was down for a good 4 or 5 days, not out of bed. And it was just not a fun experience for me whatsoever, especially being a mom, having 2 kiddos at home. That was very tough to separate myself from them. We tried our best in our own home to do that, but that alone is mentally really difficult. It wasn't until about 4 or 5 days later that I lost my taste and the smell. So those were really the only symptoms that I had, but it was more than enough that it got the best of me. I'm a pretty healthy woman. I work out, I eat healthy, we live a healthy lifestyle, and it really took the best of me through the whole process. Dr. Vargas was my provider when I went into the clinic. He did take care of me. And working side by side with him, he definitely knew something wasn't right. And it was great having him. We work with a great group of physicians, but his care for me was amazing. And I do appreciate that about him and letting me know that everything was going to be okay. And like he said earlier, the best thing that we can do is wear a mask, keep our distance, and just be mindful of that.
Thank you so much. Really, our hearts as a state go out to everybody who's been affected by this virus, those who suffer loss, those who are ill now, we wish their recovery. Many survivors still have after effects for many weeks and months. We reach out to those, of course, via phone, right, in your network that are directly affected, wish them well. We're all in this together. The next few weeks are absolutely critical. We're nearing the end of the most horrific pandemic in a century, and we have to bear down these next couple months to get there with lives intact, economy intact, jobs intact. Do it for ourselves, do it for our loved ones, do it for our frontline workers, do it for everyone who's working to keep our community safe. With that, we'll open it up for questions. I think I have somebody coordinating traffic. If they could briefly tell folks how to ask questions, that would be great. I do see one from Cody Giles about the vaccine. What advancements have been made with it? Are we sure it'll be ready in December? Sure is too strong a word. They've filed for emergency use. With the initial data that's been released publicly, I think it's likely emergency use will be granted. But the next step of the formal process is FDA needs to grant emergency use. And then we do understand that it is manufactured, ready to go. Once that emergency use is in place, very quickly, could be within a few days, Colorado will likely receive its first dosage. We expect that to be in December. And again, that first dosage will actually be for folks like Marissa. It'll be for frontline medical workers, nurses who work around COVID patients every day, and others in hospitals. And then beyond that, other first responders. Are we able to go to Marianne? So I think we're going to ask people for now until our moderators are able to go to you verbally. Go ahead and post your questions in there. And I see one from Marianne. She asked about Weld County. Commissioners have said they will not obey the state's order, moving them to red level. Well, look, we work closely with every county to give them the maximum flexibility in because we trust them as trusted partners in figuring out how to induce the behavior that we know reduces the spread of coronavirus in their area. And so we encourage that really folks who are of the community to be those frontline ambassadors for the best way to convey these messages, whether it's how to make sure you can wear masks in the most culturally appropriate way, which might be different in Julesburg and Durango and Denver. And we get that. Where, of course, we have to have a backstop is when hospitals are full. And in Weld County, there are only 3 ICU beds and 0 regular hospital beds right now. So it's not simply a Weld County issue. As much as we admire the work that's been done there to reduce the spread of the virus, it simply hasn't worked. And so it's really important that they either take these other data-driven steps that we've given them, or of course, we continue to encourage any county to put in place a mitigation plan, a thoughtful, localized mitigation plan with science to show why it would work. And CDPHE is happy to work with them to implement that. Do we have the ability to go to people? Are we able to go to Karina?
Governor, this is Alex Burness with the Denver Post.
Alex, go ahead.
Why are some counties allowed to avoid level red while other counties that may even have better metrics on the 3 indicators on the state COVID dial, they get placed at that level? Why is this negotiable?
Yeah, so I did see your article. I didn't agree with your article. I would say it's not political. What it is it's consistent with my general directive, which is give the counties a chance to implement their own mitigation efforts. So at some point, those are exhausted, and that's where the objective indicators come in. But the goal is never to apply a statewide measure in a county. The goal is to figure out how at the county level they can mitigate it. And so I have directed flexibility in doing that. CDPHE is using flexibility in doing that. And I think it's important that we do what works and encourage, 1,000 points of light. I mean, I hope that some county somewhere comes up with something that doesn't cost jobs and produces the spread of the virus. But I also understand that there are different cultures and different ways of communicating in different parts of the state, and our counties are trusted partners in doing that. There's a backstop, absolutely, where we are going to act to prevent our hospitals from being filled. But certainly my broad directive, and it's not a county-specific directive, Alec, my broad directive is work with county health, and before anywhere is moved, give them a chance on their own localized, data-driven, science-based mitigation efforts to be implemented. And there are some counties that say we're ready to move with what the state thing is now. There's others who say we have this idea that we want to move forward on. But it's not based on the county. It's just a general directive. And look, there'll be some that say we defer too much to counties and we should have strong statewide health measures from day one. There will also be those, and we're hearing them in counties like Weld, where they say, how dare the state have any thing to say about what goes on in our county? I think this is a middle ground that works for Colorado. I think it's pragmatic. I think it's effective. Frankly, I think it's cohesive. It's the best way to keep our diverse 64 counties together, is to have a little bit of both. And that's really the directive that CDPHE is operating under, to work with counties to the extent possible, but of course to have a backstop when needed to avoid our hospitals from overflowing.
Hello, Governor. This is Vinny Dale Giudice at Bloomberg News in Denver. On COVID, Denver is now at level red, but so are rural areas like Washington County, population 5,000, Prowers County, population 12,000. Why is the virus out of control? We know it's out there, but why is it out of control in such sparsely populated areas? What is contact tracing telling us, if anything? Thank you, sir.
Well, and obviously ground zero right now in our country is North Dakota and South Dakota, which are primarily rural states. And you're right, in our state, in diverse Washington County and Denver County, right? I mean, it's rural and it's urban. the book has not yet been written on the science of why now and why in a particular spot. That will be the work of scientists in the months and years ahead. Why were we spared a significant outbreak in summer? We're grateful that we were. We think it's a function of how we socialized and lived, but it's an unknown with regard to the science around the virus. What is a known is that it is a major threat everywhere in the United States right now, especially in the Rocky Mountain West and the Midwest. And that means every county in our state. Because you know what, whether in your county, it's 1 in 40 or 1 in 110, it is out there. There is community spread. And if you encounter 10 people a day, please cut back to 5, cut back to 2. But if you encounter 10 a day, it's very likely that at least one person that you encounter every day is contagious with the virus. So treat everybody like they are. Take all the precautions you need to stay safe.
Good afternoon, Governor. Ray Ercue, Post Independent. Garfield County specifically has nearly a 30% Hispanic population. Yet this demographic has the highest positivity rate in this area. What are you doing at the state level to increase outreach to the Hispanic community amid rising cases?
Well, in our communications, we have paid communications efforts in both English and Spanish, including in the Western Slope. I routinely talk and do work on Univision and Telemundo and Spanish radio with the same common sense safety measures and precautions. I think it's particularly important in multi-generational households, and many Hispanic households are multi-generational, to make sure that people know what they need to do to keep their aunt, their uncle, their grandma safe. And the best thing they can do is avoid socializing with those outside their household, taking all the precautions that you possibly can at work, and wearing a mask when you're around others. We also have a Spanish Facebook social media outreach as well, by the way, in addition to conventional paid media. So Gobernador Jared Polis Facebook page and Twitter as well.
Charles Ashby from the Grand Junction Daily Sentinel. Okay, so this is for the good doctor and for Ms. Duran. So this morning we had a group of people protesting in front of the health department, protesting going to a red zone. We have a commissioner who's about to go into office in 2 months, who believes in the Great Barrington Declaration, the herd immunity. And your own commissioners have been fighting back, going to orange level, which you guys just did, I think, yesterday. So I'm curious to know what kind of pushback or support are you seeing in your community? And to the governor, I wanted to know if you can tell me these things you're going to do in the legislature. How are you going to triage this? Are you going to focus on those businesses and individuals in those red counties? And how's that going to work? Thanks.
If I could start on any pushback, I really feel like my hospital system and community has been very supportive of what we're doing and understanding how we're taking care of them more than anything. This is a time, is what I was trying to explain, of some fears. Why is it coming through our communities? What is going on? Listening to the conversation here, why are rural areas affected? This is the nature of the virus and how it moves around. And the one thing we have is each other. We have community, we have neighbors. And anything I'm going to say right now, you're going to hear me go ahead and say, this is just about taking care of each other. This is about being there for the person next to me. And if the little thing I have to do for that is distance and wear my mask, it is helping. And it does help quite a bit, minimizing those social encounters. I know you asked specific questions about where things are at, but a lot of things are in the air right now, and how we're going to deal with this, how we're going to move through this season. And I think we could do the best by treating each other as we should, as a community.
Thank you. Charles, what was your second one for me then?
About the legislature and whether or not you're going to focus on.
Look, there's the entire economy is in need of help, and that's why we call on the federal government to do another paycheck protection program, additional support for households through a direct payment or some other mechanism. So what can we do with the limited resources that we have in Colorado? We can help the businesses that are disproportionately impacted, namely restaurants and bars, allowing them to retain the sales tax they've already collected and deploy that for their own purposes rather than hold it in a custodial account and pay the state. So at 4-month holiday, 2.9%. Also direct aid to businesses that are most impacted by the health orders with capacity reductions. And that would include restaurants and bars and potentially other kinds of businesses like gyms and theaters and venues and others that really need to help to get through this very dark winter. Go ahead. Who's next?
Hey, Governor, it's Jesse, the Colorado Sun. You've talked about these restrictions that you're implementing or the new level or limited to work. And I'm wondering, and you said about 2 weeks until we know sure, if they'll have to commit to the data. Are you going to look back at this moment in a month or so as being a missed opportunity to affect change?
I for whatever reason you're coming in and out, I'm going to ask you in a moment to maybe reset your microphone and re-ask your question. I'll briefly address one of Marianne's. Weld County does not have a mitigation plan and has refused to do so. Options. So right, this is the state backstop. We still would love to see a county-based mitigation plan that works, give them the chance to get it done. But at the end of the day, when your hospitals are full, the state has to take action. Go ahead, Jesse.
Can you hear me now, Governor?
That's better.
Okay, sorry about that. You've said that these new restrictions that you've implemented, the new level red, are not a given to work, and it'll be about 2 weeks until we see if the data plays out and how it will change. I wonder how worried or anxious you are that in a month or 2 months, we're going to look back at this moment and say that this was a mistake, that we should have gone further, and that we could have affected change.
Okay, so I think you might have lost the last part of your question, but I did hear it. How do we not second guess ourselves? There's not a lot more flexibility we have now. I mean, the reason we had great flexibility the first time around with $1,200 going to folks and unemployment plus up. Coloradans need to be able to put food on the table for their families and keep a roof over their head. And frankly, when Coloradans have the choice, do I risk losing everything I have and the roof over my head and providing for my family, or do I risk getting the virus? Quite rationally, many people would choose the risk of getting the virus. I would. I have 2 kids. I'd certainly risk getting the virus over losing my home and not being able to support them. So if there's more flexibility through federal help, absolutely. I think there's tons of Coloradans who would love to be able to stay home and be safer. They just don't have that luxury. It's a job they can't telecommute. They can't go without a paycheck for 3 or 4 weeks. They have a family to support. There's no other option. So if we can, as a society, as other nations have done, step up and help people have the tools they need to make safer decisions for their family without risking everything they have, I know that we will be more successful in both combating the virus and in preparing ourselves for a strong economic recovery.
Hello, Governor. I'm Jesus Carrasquel from Noticias Univisión, Colorado. Gobernador, ya es oficial que varios condados están en el nivel rojo. Los negocios y restaurantes aún pueden servir comida para llevar, pero los gastos son mayores y financieramente algunos ya tomaron la decisión de cerrar. ¿Cómo ayudará usted a las personas que quedarán desempleadas?
Sí. Hoy es el momento más peligroso en toda la pandemia. 1 en cada 60 personas en nuestro estado ahora tiene coronavirus y puede darlo a otra gente. Yo sé que es un tiempo malo para personas que están trabajando en la industria del restaurante. Todavía hay puestos en los restaurantes porque they do takeout, delivery. Pero yo sé que hay algunos que no ahora tienen la oportunidad para ganar dinero. Esta es la razón que necesitamos una ley nacional y ayuda nacional para empleados y para restaurantes. Vamos a tener una sesión especial de Cámara Legislativa del Estado para dar ayuda a los restaurantes y negocios pequeños. Do either of you want to address that in Spanish? Marissa or Dr. Vargas?
Marissa?
There we go. Yes, Dr. Vargas.
I think Governor Polis is asking, we have anything to address on that question in Spanish, if you missed it.
It cut out a little bit at the very beginning.
Okay, that's okay. We can go on to the next one. What's the next question?
Hi, Governor. John Daly with Colorado Public Radio. Thanks for taking our calls today, our questions today. Question about hospital staffing. 34% of hospitals are indicating they're anticipating a staffing shortage in the next week. Given the high numbers all around the region and around the country, do you have any sense of how much Colorado might be able to rely on help from other states for staffing, or some of these traveling services that provide doctors and nurses, or is the thinking that everybody's got it so bad we're just going to have to rely on the staff that we've got in Colorado?
Yeah, this is a national outbreak, the biggest national outbreak of coronavirus since the beginning of the epidemic. So there are hotspots in the Midwest and the Dakotas, and then there are most states like Colorado where there are major outbreaks that are growing. We cannot count on, out-of-state nurses and medical staff helping. We did activate an emergency staffing contract. I'm hopeful that the hospitals and working with them are also working on their hospital surge capacity for staff, because we talk a lot about beds, appropriately so, but you also need staff. You need both sides to be able to deal with this, and having all the beds in the world without the nurses and doctors and medical professionals to administer care doesn't get you a better likelihood of successful medical clinical outcomes that you'd expect. Dr. Vargas, do you want to address that?
I agree more than anything. I think we're trying to take as much precautions within the healthcare field to make sure that we don't put ourselves at unneeded risk outside of our work. And that's one of the largest messages we're trying to give out there is right now we have many Coloradans depending on us. And I can't do my job alone without my nursing staff, my MAs, and all the staff that we need alone to get things going. So I alone don't carry that brunt. And if we could all do what we need in order to be there for the people that are honestly counting on us, it'd be the best thing possible for us. So I agree.
Thank you. Next question.
Hi, Governor. This is Karina Julich with the Aurora Sentinel. So with regards to guidelines that people from multiple households shouldn't eat together at restaurants, how is that enforced? And if people are unable to stop dining in groups, are you worried that will just lead to people having private gatherings in their homes?
So look, there was a vibrant discussion among county health departments about whether outdoor dining should be closed in red counties. And it wasn't because outdoor dining with your household is unsafe. It's not. Certainly a household can go dine on a patio and have limited interactions with a masked waiter or waitress. It's relatively low risk. But what is it a proxy for, and what is the danger, and why did some health officials believe that it should not occur in red? Because it is a venue that sometimes people mix from between different households, which is the behavior that spreads the virus. So we are trusting Coloradans to dine outside with members of your own household. I mean, we order in. I think earlier when things were a little better a few months ago, I had a couple outdoor dinners with my family. But we're doing takeout delivery, and of course I'm cooking. And that's a great choice to make too. But if you really want to physically be out outdoors at a restaurant with your family, relatively low risk. But the important thing is that it is with members of your own household, because if it is not, it is exactly the kind of close proximity without masks, a prolonged exposure, an hour dinner, no mask, talking, having fun. That's exactly how the virus spreads. So keep it to members of your own household with regard to outdoor dining. Next question. Okay. Are there any additional questions? Good. Well, thank you all for joining us. We'll give one more second for questions if you have any. Hopefully, we're able to get to most of yours. It's simple, folks, and I want to make sure reporter friends on this understand how simple this is. It's not, people wrote articles about complexities of the dial. I get that. You want to report. The dial is the public health tool working with counties. Yes, we want counties to do more and better and more localized and give them the chance to do that, but it is the backstop. But for people, it's not about red or purple or orange. It's not about this or that. It's about people individually making the right decisions, which means not socializing with people outside of your household, wearing a mask around others, keeping your distance. Simple things that no matter where you live in our state, from Greeley to Grand Junction, from Trinidad to Meade, this is what we need to do better at than we are doing now. And all of these public policy directives, they're a piece of it, a small piece of it. Maybe they're 20%, maybe they're 40% of it. But the biggest thing is your individual decisions, of course, not to go to parties, not to associate, go to other places, not to hang out with others. That's really what this is all about. We want to, on the official side, walk our walk. Have reasonable rules that are in line with what people are asked to do in their private lives. But by taking these great risks in our private lives, it should be enough that you're putting your own life at risk, right? It should be enough that you're putting the life of your grandma and family at risk. But you're also putting your job and our economy at risk, because we only have levers on that business side, right? There's no ability to say, who's in whose homes and who's doing what. That's your business. We need responsibility there so that our restaurants can be open for indoor dining, so that we can have more capacity at our gyms, so that we can have more people that are able to work. And most importantly, so our hospitals aren't overflowing with patients, some of whom will not make it, and some of whom will have lasting health impacts for many, many months to come. So please, let's be cautious. Let's be careful. I wish everybody a happy and safe Thanksgiving.
All right, so that was Governor Jared Polis giving an update on our state's response to COVID-19. The governor said, quote, "You know what you need to do, just do it better." As many counties move into red restrictions at 5 p.m. today, 1 in 49 Coloradans are contagious with the virus, according to the governor, and that he was also very hopeful that these restrictions will help turn the corner for counties.